Have you ever wondered about the different kinds of gloves used in healthcare settings and why there are so many options? It might seem like a small detail, but choosing the right type of glove is actually very important for your safety and successful healing. The primary difference between sterile and clean gloves lies in their manufacturing and intended use, dictating their level of germ protection. Sterile gloves undergo a rigorous sterilization process to eliminate all microorganisms, making them essential for procedures that break the skin barrier. Clean gloves, also known as non-sterile gloves, are simply clean, reducing the transfer of germs but not eliminating them entirely, and they are suitable for general examination tasks where the skin remains intact. This distinction is crucial because the goal is to prevent infections by matching the level of contamination risk with the appropriate barrier. Sterile gloves are individually packaged and handled with strict protocols to maintain their germ-free state, which is vital for preventing pathogens from entering the body during surgery or wound dressing changes. Clean gloves, on the other hand, are typically dispensed from a box and are sufficient for protecting both the caregiver and patient during routine tasks like taking blood pressure or assisting with personal care, where the risk of introducing bacteria into a vulnerable area is minimal. When you are at home changing a dressing for a surgical incision or an open wound, you should always aim for the highest level of cleanliness, which means using sterile gloves. Before putting them on, make sure to wash your hands thoroughly with soap and water, or use an alcohol-based hand sanitizer. Carefully open the sterile packaging without touching the inside surface of the glove, then gently slide your hands in, being mindful not to touch the outside of the glove with your bare skin. This meticulous approach helps create a protective barrier that is free from germs, significantly reducing the risk of wound infection. Understanding the correct application of sterile versus clean gloves ensures a higher standard of care, preventing complications such as surgical site infections or cross-contamination. Many healthcare facilities follow strict guidelines from organizations like the Centers for Disease Control and Prevention, or CDC, which emphasize this distinction to maintain patient safety. It is not just about having a barrier, it is about having the right kind of barrier for the job. By knowing when to use sterile gloves for wound care and clean gloves for general tasks, you are actively participating in your own safe recovery. This simple knowledge empowers you to maintain a hygienic environment, promoting healing and minimizing the chances of infection, ultimately contributing to a smoother and more successful recuperation journey.